You have probably wondered why your doctor asks for a urine sample during your checkup, or why you may experience discomfort or pain during urination, haven't you? Today, I will be diving into the world of urinary health and discussing an important aspect of urine analysis: pus cells. Yes, you heard that right, pus cells in urine. It may sound scary, but don't worry. I will explain everything and give you some practical tips for better urinary health. By the way, don't forget to hit that like button and subscribe for more awesome content like this. Now, let's get started. Section 1. The science of pus cells in urine. 1. What are pus cells? Pus cells, also known as leukocytes, are white blood cells that play an important role in our immune system. They help fight off infections and foreign substances in the body. When the body detects an infection in the urinary tract, it sends leukocytes to the site of infection to fight off the harmful bacteria. The presence of pus cells in urine is an indication that there may be an infection in the urinary tract. 2. What causes pus cells in urine? There are various factors that can lead to the presence of pus cells in urine. The most common cause is a urinary tract infection, UTI, which is caused by bacteria entering the urinary tract and multiplying. Other causes may include kidney infections, bladder infections, sexually transmitted infections, or even certain medications. 3. How are pus cells detected in urine? Pus cells in urine are detected through a urine analysis, which is a routine test conducted during a physical examination or in response to specific symptoms. A urine sample is collected and examined under a microscope to determine the presence and quantity of pus cells. Section 2. Practical tips for better urinary health. Tip number 1. Stay hydrated. One of the simplest and most effective ways to maintain good urinary health is to stay hydrated. Drinking plenty of water and other fluids helps flush out bacteria and other harmful substances from the urinary tract. Aim to drink at least 8 glasses of water a day to keep your urinary system healthy. Tip number 2. Practice good hygiene. Another important aspect of maintaining good urinary health is practicing good hygiene. This includes wiping from front to back after using the bathroom, washing your genitals daily, and urinating before and after sexual activity. These simple habits can help prevent the spread of harmful bacteria and reduce the risk of infection. Tip number 3. Seek medical attention if needed. If you experience symptoms such as pain or discomfort during urination, frequent urination, or cloudy or foul-smelling urine, it's important to seek medical attention. These symptoms may indicate an infection in the urinary tract, which can be treated with antibiotics. Ignoring these symptoms can lead to more serious health complications. In conclusion, pus cells in urine may sound scary, but they are a natural part of our immune system and can indicate an infection in the urinary tract. By staying hydrated, practicing good hygiene, and seeking medical attention when needed, you can maintain good urinary health and prevent the spread of harmful bacteria. Remember, taking care of your urinary health is an important aspect of your overall well-being. Stay healthy. Thanks for watching. I hope you enjoyed this video. So, even after what you've learned, but still can't get it, no problem, because this video here has everything you need. Check it out now and crack that code and get all the information you need.